Hi, let's talk today about recovery after abdominoplasty or tummy tuck surgery. There are a lot of women who would need an abdominoplasty or tummy tuck surgery after they have had pregnancies and their skin of their abdomen sags. Likewise, many men would also need abdominoplasty or tummy tuck surgery if they have lost weight and they have sagging skin. They are considering liposuction along with abdominoplasty to give them a flat tummy. But these men and women may be very apprehensive about the surgery, thinking about recovery. So let's talk about recovery after abdominoplasty. Hi, I'm Dr. Rajat Gupta. I'm a board certified plastic surgeon working in Delhi. I'm also the National Secretary of Indian Association of Aesthetic Plastic Surgeons. I'm the director of CK Birla Group of Hospitals as well as Rosemont Rainbow Group of Hospitals. And I have my own clinics at Skinnovation and Excel Medical Center. We do a lot of tummy tucks or abdominoplasty surgeries. And the most important concern for any man or woman when they are considering the surgery is what will be the recovery. Now, as you all know, it's a surgery which will take 2 to 3 hours depending on the extent of fat and skin you might have. I usually prefer to do a 360 liposuction of your lower back, abdomen, upper, lower, and flanks so that we get a nice contour, a nice hourglass or a V shape depending on female or male, and then do an abdominoplasty or removal of excess skin in the lower abdomen. Now, of course, after the surgery, patient stays overnight in hospital and sometimes depending upon the extent, we stay even 2 nights. But we make them walk the same day. So they walk the same day, albeit with a slight bend. Now understand, this is the body and you have had an incision here. We plastic surgeons would like to give you a very fine scar, always hidden in bikini, and nobody can see the scar. So if you don't want that scar to spread, we don't want it to be under tension or used to stand straight. So walk with a slight bend for first 10 to 12 days. So your scar is minimal, it's under least tension. But you walk from the same day. So from the next day, you can go to your loo, get up, go into a chair, eat your breakfast, lunch, dinner yourself without any help. You can do it yourself, but we still like to keep you in hospital, maybe discharge the next day afternoon, evening, depending upon the vitals and the antibiotics which we have given you. And then we discharge you on some basic antibiotics and analgesics. Now I tell my patients this, of course some discomfort or pain, but most of my patients when I ask them about to rate their pain from a scale of 0 to 10, 0 being no pain and 10 being unbearable pain, most of the time for first 2 to 3 days they say, "Doc, it's around 4 to 5." Because we use some good analgesics as well as during the surgery, I inject a long-acting anesthetic into the muscle. Now what this does is, once you inject this long-acting anesthesia into the muscles and the skin, the patient is relatively pain-free. They do feel some tightness kind of discomfort because we tighten the muscle in the skin. Of course, this is what is done in abdominoplasty. So they feel that tightness and hence they rate it up to 4 to 5 of discomfort or pain. But beyond 3 to 4 days, they start recovering well and the discomfort is much lesser. I tell my patients that if you work from home on laptop, like a work from home kind of setting, then you can resume on 4th to 6th day, depending upon your own recovery. You see each individual recovers differently, their pain threshold is different, how they perceive the pain and how they perceive the discomfort is different, and how much strength they might have is also different. So 4 to 6 to 7 days is a reasonable guideline to start work from home. If they have a desk job in office, without very exertion, they just have to sit and work on a laptop, give guidance to staff, they can resume from 7 to 10 days. However, if someone has a very exertional job, something which needs a lot of movement, then I tell them to take off for next 15 days. So 2 weeks is a standard guideline. Of course, 3-4 days here and there will depend upon each individual. My patients who travel from across outside the city or outside the country, I tell them to stay in Delhi for next 7 to 10 days after surgery so that we can have few follow-up visits. It puts my mind at ease that I have seen my patient, he or she is recovering well. It also puts their mind at ease that their own surgeon has seen them and they're doing fine. I allow my patients to start cardio exercises, running, jogging by 3 to 4 weeks, and I allow them to do weight training after 6 weeks. So this is the timeline for recovery. Uh, Antibiotics, analgesics, or basic antibiotic analgesics will do it for first 7 days. After that, you see all sutures which you use these days are absorbable, so nothing needs to be removed much. The dressing comes off after 3 days. They are wearing compression garment from the next day, which they continue for the next 6 weeks. After 1 week, we advise them to apply some scar modifying creams so that the scar becomes light enough and it's not in any ways it's not visible because it's always hidden, but we still want it to be very fine and fade as much as possible. So this is the timeline for recovery of abdominoplasty. So don't be apprehensive, don't be scared. I believe that once we educate our patients and when they know that what they are up to, they feel better and they are up for the surgery as well as the recovery. Time it takes for you to feel better about your own self. Of course, they see the result from the same day, so it gives them a boost, it gives them a happiness, and they can easily recover during this time. Me and my team are always there if they have questions. All of my patients who I operate get my personal contact number after the surgery, and they can call me any time of the day or night in case of any emergency. Of course, there is a whole support system that they also get the contact number of our nurses. So we are always there during the recovery period to guide them, to help them. If you have any questions regarding the recovery of abdominoplasty tummy tuck surgery, feel free to ask me. I'm always there to help you and guide you. Take care. Bye bye.